every conference, my perspective shifts and it's swung backwards and forwards. And I think increasingly this idea, Meg, as you've mentioned, of efavirenz being somehow previously unrecognised toxicity, that particularly people with sort of very high efavirenz levels, they actually lose weight when they start treatment, which is unusual. And people who've got lower efavirenz levels actually gain the same amount of weight as people on dolutegravir. So that's suggesting it's not a dolutegravir specific thing. I think context is also critical. And Indigo, you've mentioned other markers of metabolic health, so things like your blood fats and your blood sugars. And if we think about the sort of protease inhibitor versus, say, dolutegravir discussion, sure, maybe switching to a protease inhibitor would lead to a weight change. So the studies looking at people who've had that type of switch don't show any significant impact. But then we must remember that protease inhibitors as a group are worse for your blood fats than dolutegravir. So even if you did lose a bit of weight, you might be shifting your cholesterol in a more negative direction. I think thinking about this in a very holistic way. But the way where I am at the moment is, I think for most people, newer drugs are freeing them up to gain the weight that the whole world is gaining year on year, unfortunately. But there's a subset of people who get particularly marked weight gain. And I think focusing our research on that group of people, because those are the group of people where I think actually antiretroviral switch could make more of a difference. We don't know enough yet. There's lots of work to do. But I think for many people, it's simply a previously unrecognized side effect of older drugs. So rather than causing weight gain, it's the older drugs causing weight loss.